So then my question is, how is it possible that 54% only got this question right? Right? I don't know. If either A, you know the answer, or B, you have enough power mentally with clinical knowledge and test-taking ability to knock out the other answer choices. For example, IgA action, immunoglobulin. What do you guys know about IgA? You guys know something about IgA. IgA, when I see IgA, I think of respiratory and GI, respiratory and GI, respiratory and GI, respiratory symptoms, and also GI symptoms, like giardia lamblia, diarrhea. This could have diarrhea. Africa, fever, chills, cough. Now, all I see is respiratory stuff, swollen fingers, and anemia, and obviously have scleral jaundice. Okay, so usually IgA, right? Sinopulmonary infections, as well as GI. This is important. A test writer is going to use, if they put IgA as the actual answer, they will have to put diarrhea and GI symptoms. So this patient has bacteremia due to strep pneumo encapsulated pathogen. CD and its complications do not directly affect IgA action. A heads up, when it comes to USMLE, anytime you see this as the answer choice, unless they give you respiratory issues and GI issues, it's never the answer. And there it goes. Respiratory burst. What do you guys know about respiratory burst? Ooh, we did that back in immunology a little bit. Respiratory burst is a very, very good topic to cover when you go a little further back in again. Do you guys remember this? Do you guys remember this? CGD, cat positive organisms. Yeah. So respiratory burst, yeah. Respiratory burst increases the risk of infection with cat positive. So 11% chose IgA, which we know can never be the answer in this case because we didn't see anything with GI infections. Fair. And also there's no really correlation to it. Mucous membranes usually. Second, respiratory burst. We did back in immunology, we did congenital immunodeficiencies. Remember that? We had the B cell disorders, the T cell disorders, the B and T cell disorders, and the phagocytic dysfunction disorders. Yeah. And that's one of them, CGD. CGD is cat positive organisms. At least know the cat positive ones. You hit this, and we've done it before. We have many things. We have nocardia, Pseudomonas, Listeria, Staph, Serratia, Burkholderia, H. pylori. You guys need to know them all. Memorize them if you want. Write them out 20 times. At least know the top 5 that they're going to test you on, which clearly it's either Staph, Serratia, Burkholderia. These are always testable, okay? So yeah, it can't be that because this is strep. And then we wanted Staph in this case, right? Staph is usually cat positive. Okay, so that's how. And by the way, patients with CGD, as you know, they're recurrent, severe infections where lungs, skin, lymph node, liver. I promise you, if you do the work or did the work to learn this once or twice before in the past, 5 months, a year, 2 years ago, reading this and reading this is more than enough to continuously keep you upgraded with the content, because you have to understand there's so much information to study that it depends on the explanations in the QBank. And I could promise you these explanations are very, very good. They're written very well, and you can learn from them a lot easier than other QBanks, okay? So we have complement production T cell. We know about T cell. Remember back then? Immunodeficiencies, T cell. Remember, DeGeorge's was a T cell disorder, right? T cell differentiation. Thymus. I've seen many questions talking about thymus. So you need to know about B cells and T cells, because in this case, thymus increased risk of infections. T cell disorders, we know DeGeorge's. DeGeorge's has a catch-22 mnemonic. I mean, it's right in front of you here. So typically, we know DeGeorge, they have low calcium. Low calcium causes tetany. There's no presentation here. So 17% with the complement production. What do you think that is? Complement production clearly is a good answer. But this patient has bacteremia due to strep pneumo, SCD,